Kaitlyn Flames. Kaitlyn Flames. Kaitlyn Flames. Kaitlyn Flames. Kaitlyn Flames has an emergency.
Why, I needed surgery.
I felt pain during my surgery.
Not the pain. We are both board-certified toothologists. And we are here to investigate. And as a bonus, we will also be performing our very own tooth surgery in this video. So stay tuned. Let's go.
You know how a lot of people are scared of going to the dentist?
Yeah, of course.
I was not one of them. In fact, I had a pretty good relationship with my dental care. I get to skip school and I get a cheap dollar store toy afterwards. Mother, take me to the tooth man right now. One time after my routine checkup, I even said, I'm gonna take 2 this time because I was really well behaved. So they gave me like 5. That was a good day. Anyway, that's
5? I mean, are we running a charity here? How many toys do you give the kids?
Depends. If they're good, 5.
5 toys?
If they're bad, 6. Maybe they're having a bad day.
6? See, this is how you enable the bad behavior.
That was a good day. Anyway, this all changed drastically when I was around 9. We had just moved countries and I started to have a really bad toothache. At first I was like, okay, this is normal. That just means it's gonna fall out. Then it got to a point where I wouldn't want to eat, and as a bonus, it turned purple. Of course, my parents noticed and asked me if I wanted to go to the dentist, but to their surprise, I said no. Look, the dentist in Canada was the only one I had up till that point. I didn't trust some random other dentist to help with my boo-boo.
The free dentist. Listen, the purple tooth, that is a very big concern. That is actually called purple tootholitis, and that is something that we take very seriously in Toothlandia. So if you get the purple tooth, go to the dentist right away. Don't be a hero. Oh yes, and this is Nurse Lola, by the way. I don't know if I said that. I am Dr. Bo Healington, and we're here to...
I didn't trust some random other dentist to help with my boo-boo. My dad eventually convinced me to go by saying the new dentist was a friend of his and it'll just be a quick checkup. So we went, and for the first time in my life, I felt fear. I don't know why. This literally never happened before. But the more we waited, the sounds of the tools, the posters that look like they've been there before I was even born, and even the TV started to increase my panic. The assistant noticed the look of absolute terror on my face, so she tried to calm me down by saying, "Don't worry, you won't feel a thing."
Nurse, you're supposed to soundproof the room so they can't hear the screams! You're not supposed to let them hear the screams. When I was a kid, my dentist had a Nintendo 64 in the waiting room, so no matter how loud the screams were, we couldn't hear it because we were playing The Legend of Zelda.
How about in medical school?
In medical school, I just played The Legend of Zelda before all of my exams so that all of the dentist knowledge would come back to me, all the toothology.
Little lady, it's your turn.
Oh no.
Oh my god, I'm so dead. Hello there. Open wide, let me see that tooth. Nothing too serious. Just needs to be pulled out. Why don't you take a seat?
Easy.
Now, not to brag or anything, but I was the fastest kid in my elementary school. So... Did she just... Yep. Our house was a 10-minute walk away from the place, so I just ran away. In my defense, the first thing I saw when I walked into that room were the hints of what happened to the previous patient. I think my reaction was justified.
Guys, what is this, amateur hour? You're supposed to hide all of that in the evidence bin. I mean, the medical waste bin. You're supposed to hide all of that. They can't see it.
You kind of look like her doctor.
I think the doctor is not a male doctor, but maybe it is a male I promise this was not me.
That literally looks like you in medical school.
I promise, yeah, the old medical school photos. I promise it's not me.
I remember my parents chasing after me with the car, but they would describe the scenario a little differently.
Aww.
Should we help her? Nah. Eventually, I did go back to get my tooth pulled out, but then all was good.
Yay.
I'm just kidding. He pulled out the wrong one.
No!
He had to go back twice. Your choice of dentist is as bad as your ability to use the internet. Seriously, he's had his bank account info stolen twice, his laptop hacked, and his identity was stolen. I've told him countless times to just get a VPN, to which his response was to click on something that said free VPN.
No!
Which turned out to be malware. I try really hard to teach him about safety on the internet, but admittedly, I'm not very good at it either. So this video is sponsored by...
Very good, very good. Kaitlyn is saving up money for any of her dental needs that she needs down the road. It's good to be proactive about that. It's good that Kaitlyn took a sponsor so that any future dental issues can be handled easily. That's very good.
Fast forward a few years later, I was in 6th grade and I started feeling really insecure about my smile. Whenever I laughed, I wouldn't just cover my mouth, I would cover my entire face.
Oh, no.
So when I found out that there was a thing called invisible braces, I immediately asked my parents if I could get some. So everything looks good, but there's one problem. I'm feeling a little bump on her palate, which typically indicates that there's a tooth under there.
X-ray.
There's a tooth in the middle of my mouth? This is called an impacted canine. And the only way to treat it is to perform a simple surgery where you expose the tooth, attach a chain to it, and over the course of a few months,
you gotta Hey, you're supposed to make the kids feel comfortable. This is a normal procedure. We do it all the time.
Oh my gosh, that looks like so much fun.
It's fun. It's a fun.
Mario, you know, the chain dog?
Yeah, the chain chomp on the... Yeah, exactly.
Basically have your own chain chomp.
She is doing just a chain chomp to use a chain to bring her chomper to the front. Exactly.
That's so
if
cool.
you love Mario, you would love this surgery. It's a simple procedure. It's a simple procedure.
It's a simple formula. It's a simple formula.
All right, what is it?
I mean, the formula is, first of all, there, you know...
Yeah, that's what I thought. You have no idea what you're talking about.
Yeah, so I better just shut up.
Uh-huh.
Attach a chain to it, and over the course of a few months, slowly pull it to its proper spot. When I heard the word surgery, I instantly went into a state of denial. We asked for a 2nd, 3rd, and 4th opinion. The first 2 couldn't find anything and got my hopes
We're
up,
sorry,
but on the
Kaitlyn.
4th one, since this time
Just
we
do an
had the
X-ray.
screen turned towards us, I saw it, pointed at it, and my stomach sank. Which honestly should have been my first red flag, because in a room with 4 adults, one of them being a certified professional, why was the 12-year-old the one to point it out? Also,
Very strange.
How did you all miss this? It was sticking out like a sore thumb. The tooth was
It's sticking out like a
literally
sore tooth. Yes, I mean, we always do a preliminary x-ray right away in a situation like that. Especially if another doctor said that she had the tooth there the whole time.
You are an incredible dentist.
Okay.
You solved
I'm
that.
not a dentist.
You
I don't
solved
think
it in like
I don't
5 seconds.
I don't think I'm allowed to say I'm a dentist. I'm a toothologist, okay? A certified toothologist. I don't know if nurse is a protected term, so I think we can say that you're a nurse because you are a nurse.
The tooth was literally chilling
The tooth was
sideways.
loose.
Y'all need to have your licenses revoked. I walked out being scheduled for surgery in 2 months. While waiting, I read everything I could find about my condition. I even found out that I was gonna need braces. Not the magical invisible ones. The metal train tracks that scratch your cheeks and forbid you from eating everything.
That's
you
what
want.
it takes
But
sometimes.
since I had 2 months to prepare, when the day of the surgery came, I walked in feeling a little nervous, but I shake that surgeon's hand with confidence. Little did I know that I was about to experience the biggest fear of anyone who's about to get surgery.
Oh no. Oh no. Oh no! Now, I know a lot of people are very intimidated by the dental surgery, but I promise you, it is one of the most pleasant experiences that you can possibly have in your life. It's euphoric, a lot of people say. And so, in order to prove this to you, we are going to perform a very short, non-invasive surgery of our own on the funny dentist surgery. Okay, let's go. So
This is so cute.
So this little girl needs to have a tooth. She needs something done with her teeth, and so we're gonna help her out. I am a board-certified toothologist, and so the toothologist has to do the tooth. Now, this poor girl, part of the problem is she's got like a Lola mask on. So you can't do the tooth surgery with the Lola mask on. Okay, and so for step 2, we have to open the mouth. And I know that a lot of people, they're very shy about their teeth, that some people are insecure about their teeth, they don't like the way they look. I promise you, it's okay. No matter what, we've seen worse. It's okay. There's nothing to be embarrassed about. I mean, it's okay, little girl. We'll help you out.
You can fix this, right, doctor?
We can. Oh, it's nothing. It's. It's nothing, we can handle it. Listen, this happens all the time. You know when you leave a candy in your mouth, it happens all the time. Okay, so we zoom in and then, okay, stop salivating. Let's just get that out with our little vacuum hose. First, the fact that you didn't brush before you came here is, I find a little bit insulting, but I guess you wanted a professional to do it, so we will brush your toothing turns right now. There's the teeth. I don't know why we didn't take the candy out before we started doing this, but you know what happens. Now we use the hook. The hooks!
The hooks! The hooks! How about a mint?
Every child's favorite thing at the dentist. Wow, these were really wedged in there. Pretty unbelievable. I can't believe you did this. Next time, maybe look at your teeth every now and then. Okay, now we use this thingy. We call this a hydroplane. To the water squirtomeningitis. The swollen gum curer. And then, okay, this is the part everyone hates, but I promise there's nothing gross about this. We do it all the time. It's a very simple procedure. It's okay. It's okay. We do this all the time. It is nothing to be embarrassed about. Nothing to be embarrassed about. It's okay. Wonderful. It looks better already. Okay, just one more. It's just one more. It's not a big deal. It's not a big deal. Oh my gosh, I can't look at this. Okay, and now we have to put the cotton in, and it's very simple. See, Kaitlyn Flames had nothing to worry about. It's very simple.
Bloody Mary.
And now we put the fake teeth in. Much better, much better. I can fully open my eyes again. And then we use this thing on this. Oh, we drill into the cavity. Yes, it's a cavity. The filler. And then we use the flashlight to look at it for a little bit, because we just want to look at it to see.
You're curing me.
We're curing the thing. And then this is just for our own collection. We find this stuff interesting, so we want to store that in our medical supplies. And then we blast the aliens! Blast the aliens! That's the problem, you had aliens! Okay, and then a very simple... And then we treat the... And then it's perfect. It's perfect.
Amazing job, doctor.
See, it's very simple, and as long as you're with a trusted doctor, or toothologist rather, it will be fine, I promise you. So let's move on. Let's see how Kaitlyn's surgery went. Okay, Kaitlyn. We're going to do...
Aren't I supposed to be asleep during this?
No, it's okay.
No. That won't be necessary. But I did my research, and since my tooth is pretty deep in there, the internet said, don't believe everything you see on the internet. Trust us. You're in good hands.
Okay, my friends, I'm sorry to say, I know that I am a registered toothologist, and we like to say that we know everything, but sometimes there are toothologists who are stupid idiots, or people, or even worse, people who just pretend to be toothologists. Could you imagine that? Is there anything more stupid than that? But I don't know, I guess. You can't really tell the dentist that you can't... What the dentist says goes sometimes, I mean. People, I just wanted to let you know, this is a tip for you. If you want to make sure your teeth never go bad and never have problems, one of the best ways to do that is to boop the like button on this video, leave a comment letting us know how much you liked the video, and subscribe to RobertIDK and Kaitlyn Flames. Apparently that is the only way to make sure your teeth are always okay. So make sure you do that, and let's continue.
Trust us. You're in good hands. When they started, I could hear and feel everything that was happening, just without any discomfort. But after a few minutes, I was hit with the horrible realization that I started to feel pain. It wasn't that bad, but since you're not supposed to feel any pain, I knew something was wrong.
Oh, no.
I tried to alert them, but since my mouth was stuffed with tools and I started panicking, they thought I was just being hysterical and kept telling me to stop moving. Before doing a procedure on a conscious person, doctors will use local anesthetics to numb the area. So while the person is awake and aware, they can't feel anything that's going on in that region.
Of course.
Unfortunately, in my case, it was not working. As time went by, the pain just kept getting worse.
See, this is a very important part of it. You're supposed to inject the area with injectivulitis in order to nummification of the dental glands.
You're right, doctor.
And that will make the dentistry go to the numb so that the procedure can be performed. I mean, it's a simple formula. It's a simple formula.
It's a simple formula. It's a simple formula.
You've never made a mistake like this in your
I've never made a mistake like this.
30-year career.
Exactly, yeah. And so it's very unfortunate. I mean, this dentist, this toothy man.
He's a quack.
He's a quack. For all I know, maybe he just put on a dentist costume and is just pretending to be a dentist.
Exactly. Where did
And
he even get his degree?
And that would just be sick. So hopefully, well, I don't think this is gonna go any better. I mean, I think this is already done. I think Kaitlyn's already cooked. I think she's cooked-lyn in this video.
Cooked-lyn.
She's cooked-lyn so far.
It was not working. As time went by, the pain just kept getting worse. But when someone is doing a delicate procedure and has a sharp tool in your mouth,
Spooky.
you kinda have no choice but to just sit there and wait for it to stop.
Yeah. That's all you can
Anyway, after they were done, I couldn't talk, so I had to use a pen and paper to communicate.
Aw.
Oh yeah, pain is normal for the next few days, but right now she's fine. You little...
Fine?
I kept
You
insisting
think
that
I'm
I was
fine?
not fine, but these guys acted like I was just being dramatic. At that point, I was both physically and mentally exhausted, and I just wanted to go home.
Oh.
It was the most unpleasant experience of my life, but it was finally over.
Oh no.
Oh no, it was not! Well, hopefully, at the very least, if she was in pain during the surgery, hopefully she was sent home with some proper medications like dexaflomecazine. That usually helps with the swollen gums and the pain and the hurting of the gums after the surgery, especially if you have itis. That will definitely help with the tooth hurt.
You were so smart, doctor.
Thank you. But you already knew all of this because you are a nurse yourself, and you were there for all of the procedures I performed. I have never had an unhappy patient.
I learned the best from you.
You learned the best from the best.
It was the most unpleasant experience of my life, but it was finally over. I was really tense and stressed throughout the surgery, but after being outside for a few minutes, I took a deep breath and started relaxing myself. Then, out of absolutely nowhere, the pain in my mouth started pulsing.
Not the pain.
Is that? Nope, we are numb, and... Oh, nope, that's pain. We're in pain.
Not the pain!
This time, the pain was unbearable. It was like my brain suddenly became aware that a small chunk of me was missing and was focusing all of its attention.
Oh
This
no, she's suffering from a small chunk of missing golokitis. When there is a small chunk missing, most patients are totally fine when a small chunk of them is missing, but for a very small percentage of patients, they will suffer from kopalopalopalopalitis.
What did he say?
And they will experience this.
Doctor, it's not funny. This is a serious
He's a serious man. I'm sorry. I'm hysterical. I'm so sad for her that I can't help but laugh. I'm sad. I laugh because I'm sad.
And was focusing all of its attention on it. This description is not for the faint-hearted, but it felt like someone was hammering a nail through the roof of my mouth. In the operating room,
sometimes
I
we
was
do
just
that.
making please help me noises while trying not to sob. But this time, I was straight up screaming and crying. The people on the street were looking at me in horror, and some of them asked if they should call for help, but I was in so much pain that I couldn't focus on anything. My family panicked, and we rushed back to the dentist, where all they did to help me was give me a glass of water and say that it really shouldn't hurt that much.
What?
Being in pain
What?
sucks, but being in pain and not
She
being
trusted you. Her teeth were in your hands. It is up to you as a board-certified dental oncologist. You were the chosen one. You were the one who was supposed to help her. Now you've only destroyed her. So they didn't send her home with anti-pain.
It's so sad how much they ignored her pain.
Yeah, what is another prescription that they could have given her for the pain?
Healing water.
Oh, healing water. Okay, that's a bit less of a...
Simple.
Yeah, well, I think that's what they tried to do. You see, I think that's the problem. They tried to give her the water and the water.
No, they gave her regular water. She needs the healing water.
From
The one covered by insurance.
Bo Healington, of course.
Exactly.
The board-certified water.
Being in pain sucks, but being in pain and not being able to say so is another form of torture. I gained a lot of empathy for babies that day. The worst part is that the procedure wasn't done. I had to come back once
more?
every 2 weeks for an entire year
There's
to
more?
get that dumb chain pulled. And let me tell ya, even touching the chain with my tongue would send a sharp jolt of pain down my spine. This
Kaitlyn.
experience holds the crown for the most painful thing I ever went through
She had kidney
and led
stones?
to a really bad dentist phobia. Actually, not just a dentist, literally anyone wearing a doctor's coat.
Kaitlyn, I'm sorry.
Now you've scared her
I
this
didn't-
entire video.
I'm sorry, Kaitlyn. I had to do this video in uniform so people would know I'm a toothologist. A real toothologist. They wouldn't know otherwise. But I'm sorry. I didn't mean to put you through the pain.
You're making her relive her trauma right now.
Now Kaitlyn can never watch the video. I was hoping to give her real medical advice. Or sorry, this is not medical advice. I was hoping to give her toothology tips. I think I can say that.
Literally anyone wearing a doctor's coat. My parents occasionally make fun of me because I used to be one of those kids who wasn't afraid of anything hospital related, and now I'm a 19-year-old that turns into a feral animal at the mere sight of a pointy object. I go through extreme lengths to avoid going to the dentist, and even passing by one fills me with indescribable fear.
I'm
but
sorry.
I'm slowly working on fixing that.
Kaitlyn gave some very good advice here. The best way to avoid the dentist is just keep your teeth clean yourself. Keep your teeth clean. Make sure, and this is an important thing that a lot of dentists, I think, or sorry, a lot of tooth people don't talk about, is it's very important to chew hard foods. If all you ever eat is soft foods and you never chomp with your teeth are more likely to shift. And this is true. I am not joking about this. It is important to chew the food. Breathe through your nose and brush your teeth a lot. And floss as well. Do the floss.
How long should they brush for, doctor?
Well, it's a simple question. A full 2 minutes twice a day is what I always say, you know? That's my my thoughts. And maybe you can avoid a horrible fate like this. And so, my friends, if there's one piece of knowledge we can impart on you today, it's that if you have a tootholocolitis, you must always see a toothologist. And you must always remember to brush your teeth, take your palabasam, and always floss. And also subscribe to RobertIDK. Also subscribe to Kaitlyn Flames. And aside from that, here are the other videos where we looked at Kaitlyn Flames. Make sure you watch those videos. Those are very fun. If you have not seen all the Kaitlyn Flames videos, here they are. Here's another video that you'll like. We love you. Have a toothy day. Bye.